The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Good morning. Good morning, listeners. Good morning, Daryush, who's my co-pilot today. How are you?
Good. How are you, Dr. Lederman?
Fine. And in control room, we have Reggie and Ed, who are responsible for technical aspects of the show. It's live. It's a live show, so you're welcome to call in with questions, medical questions, cancer questions, comments, concerns about health. Our number here at WOR is 1-800-321-0710. 1-800-321-0710. And I should remind you, if you just want a booklet about our work and DVD, we're happy to send it to you at no charge. You can call and give your name and address to Reggie, or if you have questions, stay on the line and we'll try to answer all your questions. So, Daryush, there were a lot of calls after last week's show, and I kind of have a list of them. What impressed me quite a bit was several women who came, actually over the last few weeks, who heard the show. They've had a lump in their breast for the last few years, and for whatever reason, never sought medical attention until they heard the show.
Oh, wow. Well, that's great news, huh?
Well, it's great news for them. These 3 or 4 women had lumps that have been growing over several years.
And that can get very dangerous if it gets in the bloodstream, right?
It can be fatal if it's not diagnosed early.
Mm-hmm.
So I'm thinking about one woman who I hope is listening today, and she came forward, a beautiful woman. I told her she looks like Audrey Hepburn, and had a lump growing in the breast for about 3 years.
Wow.
And just was very reluctant to get involved in the medical profession and scared. And met with her, examined her. We were able to do a little biopsy with a little needle, so it was totally painless.
Oh, that's
put the
good.
Needle in.
Okay.
And made a diagnosis of the cancer.
I think that's what people are afraid of. They're afraid they'll get hurt or have scars or something like that if they do get a biopsy.
Right. So they're afraid of the pain, afraid of suffering, afraid of the cost. And so I just tell you what happened to this woman. So she came in, she was about 70, and as I say, beautiful. She looked like Audrey Hepburn. She had this mass growing for 3 years, put a little needle in. She didn't feel a thing, got the diagnosis of cancer. We did staging with a PET CT scan. So we were able to give a small injection into a vein, and then an hour later, look at her whole body. Mm-hmm. And the good news in her was that there was no distant metastasis. All the cancer was confined to the breast area.
Good.
So she has a great chance of being cured. And I'm saying it, number one, to recognize that she came forth, but number two, there's probably other women out there who are afraid of getting diagnosed.
Definitely.
And it's really critical to come forth. Being diagnosed and being treated doesn't have to be painful or scary, and maybe it will lift a big burden off one's shoulders by finally coming forth. So I would urge people, if they themselves have these lumps that are undiagnosed, or if their loved ones do, give us a call, and we would do everything we can to try to make it comfortable.
The sooner the better.
Sooner the better, and get the right workup to tell you exactly if it's cancer. Some people may get a biopsy and it's not cancer. So that's a big relief also, to be worried that you think you have cancer and you get a biopsy and you find out that it's not cancer. So either way, you kind of win. If you don't have cancer, the burden is off you. And if you do have cancer at least you get diagnosed early enough that you can make a difference.
Yeah, knowledge is power, and especially when it comes to our own bodies, we want to know what's going on inside, figure it out.
It's your body. You only have one body, and
That's
if you ignore your own body, you're going to be probably in trouble. And some people say, well, I'm already 70 or 75. But actually, the typical person who's 70 or 75 is probably going to live another 20 years.
Yeah, it's a long time.
So it's a long time. So you want to stay in good shape and try to get, most people want to get as much mileage out as possible. It's always a personal decision, and no one is in charge of anyone else's body. Everyone's in charge of their own body. And I always tell people they're the president of the United States of their body.
United States of your body.
Well, you're the president. You get to decide who's going to help you, who's not going to help you, what to do. But sometimes people are just scared and they don't know what to do. So I encourage you to give us a call or come in during the week, and we can help guide you if you want, or we can help work with your doctors. But you certainly are welcome to come in. We also had several calls about prostate cancer, and it's obviously a big issue in America. Breast cancer occupies about 200,000 women a year with new diagnosis, and prostate cancer is about similar in men, about 200,000 men a year. So it's actually similar diseases, very frequent, very sensitive to treatment, both very likely to be cured. And there were two major issues this week, and one major issue was Gleason 8. So do you remember anything about Gleason and what it means?
Yeah, the Gleason score is the index they use when they do a biopsy of the prostate in two different spots. You get a score 1 to 5 on each spot, and then you add them up. So you could have a 1 plus 1 is 2, which is very rare, or a 5 plus 5 is 10.
And the higher the number is...
the worse it is.
Right, so it's more aggressive. So I had a gentleman call up during the week, and he wanted to know what to do about his Gleason 8.
Okay.
And one of the big preconceptions is that if you remove the prostate, you're home free.
Oh.
And so I wanted to bring data from probably the best surgeon in America, surgeon who developed nerve-sparing operation. It's not to diminish any other surgeon, but several surgeons are well known and have treated thousands of patients and developed new techniques.
So who's this one?
Well, I'm not going to use names, but I'll be happy to speak to patients individually. But this is from Baltimore, so I should give a pretty good idea.
All right.
And he published his data for Gleason 8, 9, 10 prostate cancer. So he put them in one group. And so if you have one of the best surgeons in the world treating great patients, highly motivated patients who come there for treatment, and he cuts out the prostate for Gleason 8, 9, 10, what do you think the success rate is 5 years later? How many patients are cancer-free 5 years later if you remove the whole prostate?
I don't know, 50?
Well, wouldn't you say 100? Most people would say 100 because you had cancer and you removed it all, so why wouldn't you be 100% home free?
I thought that when you had a Gleason 8, a high score like that, then the chance of metastases was pretty high, no?
But presumably they had tests done, they had bone scan, CAT scan, PET scan, MRI that showed everything was negative.
Yeah, you're right, it would be higher.
So if you have prostate cancer, Gleason 8, and you cut it out, what's your chance of being cancer-free 5 years later?
I don't know, what is it?
Well, you want to give another number?
70%? I'm very pessimistic here, as you can tell.
Yeah, you're pessimistic. Well, the fact is it's worse.
No.
It's a lot worse. And this is, I think, a fantastic surgeon removing the whole prostate, Gleason 8, 9, 10.
Don't you need your prostate?
5 years later, it's 41%.
Wow.
So it means it's 60% of patients, men with prostate cancer, have progressive cancer even if the surgeon removed it all. And this is not baloney data. This is published data in medical journals. You can go to the library and look it up. It's well-recognized data. This is not moonbeams and fairy tales. This is real data and real human beings. 60% of men have recurrent cancer within 5 years.
That's terrible.
And what about in the next 5 years? Do you think the cancer keeps on coming back, or do you think it stays at 40%?
Probably gets worse, doesn't it?
It gets worse.
Yeah.
So actually at 10 years, if you have a Gleason 8, 9, 10 prostate cancer,
And
go
you
to a
remove your
fantastic
prostate.
surgeon.
Mm-hmm.
What do you think the number is? 10 years. What % of people are home free?
I don't know. I'd give it another 10%, maybe just 30 now, right?
It's actually 23%.
Wow. That's horrible.
23% of patients are cancer-free with Gleason 8, 9, 10 having surgery.
Yeah, memo to self, do not get surgery.
Well, you can have surgery, but you have to be aware of the consequences. And one thing about the
it's
show,
not very good. Why would I want to do
because we want the show to educate people to understand principles
that? Yeah.
and not baloney.
Right.
And I think if you knew that you only had a 23% chance of being cancer-free with surgery, you'd try to have another option.
Absolutely.
And we can also talk, maybe we'll talk in the upcoming weeks about complications from surgery for men. And the main ones, of course, are sexual dysfunction, which means the erections are not coming, and lack of urinary control.
All right.
So those are big complications in the world of surgery.
Yeah, what does the prostate do, really?
Well, the prostate does a variety of things. It produces fluid. So when there's an ejaculate, the testicles produce sperm, but the prostate produces the fluid in which the sperm live.
Right.
So that's probably one of the main functions.
Okay.
And when the prostate's removed, that function's gone away.
Yeah.
So several people called about, well, why not get proton beam? You know what proton beam is?
What is it, Doc?
Okay, so do you remember back to high school chemistry and the atom?
The hydrogen atom, yeah.
Well, any atom. Do you remember any atom?
I remember most of the atom.
Okay, so there's something circling around the nucleus. Remember those things that go around like the Earth goes around the sun?
Those are electrons.
Those are electrons, which are charged.
Negatively.
And in the center, so there has to be a balance, right?
You got protons and neutrons.
Protons and neutrons. So you're a great chemistry student.
Yeah.
So the neutrons are neutral and protons are positive, so it's really easy to remember.
Yeah.
So protons have been around for 60 years. People have been using protons to treat cancer for 60 years.
Oh, okay.
And now all of a sudden,
Protons have been around forever, really.
for medical purposes,
Okay,
that's
okay, right.
Yeah, that's right. So to separate them out from the atom and to shoot them into the cancer, they've been around, let's say, 60 years.
Okay.
So they're not new.
I didn't know that, yeah.
And there's a big push right now to develop proton cancer treatment centers. And many people think that the newest treatment is the best treatment. And we discussed that last week here,
But
that
that's not true.
half the time the newest treatment
It's worse.
is worse.
Yeah.
Right. And we can talk about that again in the future. But there's an article in New England Journal of Medicine and shows that actually half the time the newer treatment is less good. With proton beam, and in our booklet, people can call for this booklet if they want, on page, turning to page 16 of our prostate booklet, for Gleason 8, 9, 10, if you go and get proton beam treatment for your prostate cancer, 5 years later, what's your chance of success?
I'm guessing it's a lot better than that surgery we're talking about.
Well, it's not much different. It's actually 48%.
Oh, wow. So, and the other one was 41. So
Right. So it's not much different.
That's disappointing.
And our results are 46% better than proton beam, and they're about 70% better than surgery. So sometimes our results use prostate brachytherapy and body radiosurgery as a mixture, and we've treated about 3,000 patients. So we have a better chance of being cancer-free by 50 to 70% better outcome with better quality of life, sexual function, and urinary function. So these men that called in this week, I emphasize that and really encourage people to look at the data before you make a decision, because the differences are huge.
Yeah, the brachytherapy, that's the with the seeds and stuff.
Right, so you can put the seeds in. The seeds go in the prostate through the skin.
Right.
There's no cutting. Just get poked in with a needle. It takes about 45 minutes, and the patients an hour later go home and don't feel a thing. And it allows us to give a large dose of radiation just to the prostate quickly.
Right.
So, and in some men, you can have just that one treatment. So the big appeal of it is it's very focused, very intense, very well tolerated, And for some men, not glycinate, but for some men, you can actually have brachytherapy only. So in 1 hour, you're done with your treatment.
Wow.